This video will discuss details about laser skin tightening.
Laser skin tightening is the enhancement of changes related to aging and some damage to the skin. Patients who are good candidates for the procedure are women or men who want to correct the usual changes, including wrinkles, skin laxity, and pigment. The laser targets water, allowing for the stimulation of lost collagen and elastin. The procedure is simple. The laser makes microperforation to the skin, stimulating the regenerative properties. The endpoint is a healthier look to the skin. There are two types of lasers. The first one is called fraxel. It works deeper and delivers a lesser degree of energy. The recovery is faster and multiple treatments are needed. The second one is called CO2 laser. It works more superficial and delivers greater degree of energy. The recovery is longer, but only one treatment is needed in the majority of cases. The procedure is done in the office under topical anesthesia. It usually takes an average of 45 minutes. The recovery time is 2 to 3 days with the fraxel and 7 to 10 days with the CO2. When I combine the fraxel and the CO2, the recovery time is less compared to CO2 laser alone. It usually gets reduced to around 4 to 5 days. Some important considerations for the procedure are to avoid recent tanning or future exposure to sun or tanning beds. Cold sores may reactivate with the laser treatment. Please make us aware if you have suffered from this before. We will need to give you preventive medication to avoid this complication during the healing process. Other considerations include the use of Accutane within the prior year, pregnancy, active lupus disease to the skin, and skin cancer. Some frequent asked questions are, would I have blisters with either procedure? No, the microperforations allow for the escape of fluid, preventing the formation of blisters. Would I have bleeding with the procedure? Some patients may develop pinpoint bleeding, especially if they have small capillary vessels on the area of treatment. When will the swelling go away? It usually takes 3 days with fraxel and 5 days with CO2. When can I use makeup? 1 week should be okay for light concealer and 2 weeks for regular makeup. How does it feel the first day after the procedure? Tina, our clinical coordinator, will tell you the details. Okay, today we're talking with Tina, our clinical coordinator, and she had CO2 laser yesterday. So today's her first day after the procedure. So Tina, how was the procedure yesterday? How painful was it?
I had a topical anesthetic and it was not any more painful than the fraxel, which I had as well before. You can feel it a little bit, but it's not anything that you can't stand. It's just a mild burning feeling, and right now is almost 24 hours after my procedure, and through the night I had some swelling and just a tiny little bit of blood. Today I feel a little bit of crusting on my skin, but no pain at all. I didn't feel any pain last night either. Probably 2 hours after the procedure I could feel a slight burning, but didn't have to take any kind of pain medication, just some cold compresses, and by evening I had no pain at all.
Perfect. And do you have any strange sensation? There was something that bothered you, maybe the bleeding or something like that?
No, there's a lot of fluid. My eyes are very swollen. My face is probably twice the size it normally is. Very red. To touch it, it feels sensitive, but there's no pain or itching or burning right now.
Very good.
It feels a little bit dry.
Perfect. So what are you doing to try to counteract all these things?
I'm putting a vinegar soak, a mild acidic acid soak of water and just white vinegar, probably 2 to 3 times a day, and then I follow it with Aquaphor, which is a very moisturizing ointment.
Perfect. So we'll continue this report with Tina's progress of how her CO2 did for her face. Now let's review some outcomes of patients that have undergone this procedure. This patient was concerned about the pigmentation and damage of the skin to her neck and décolleté. Please appreciate the significant improvement in the pigmentation and quality of the skin. This patient was concerned about the fine and deep wrinkles to the mouth and cheeks. Please appreciate the significant improvement to the perioral area. This patient was concerned about the fine and deep wrinkles to the skin of the face. Please appreciate the significant improvement to the skin and wrinkles. This patient was concerned about the fine and deep wrinkles to the skin of the face. Please appreciate the significant improvement to the skin and wrinkles.
Thank you for considering us for your procedure and welcome to our practice. Please contact us by phone, email, or through our website.